you for joining us on Savvy Senior Sources, Talking with Experts. Let's take a moment and hear from our sponsors, GWG Life and Reverse Mortgages SIDAC.
Provide for your long-term care. Convert your life insurance towards payments for long-term care. If you are concerned about future health care, you can convert your life insurance to pay for home care or assisted living. Health problems can be stressful enough without the added burden of financial obligations. If you feel that you no longer need your life insurance policy, you may want to apply the value towards long-term care.
Hi, I'm Beth Paterson, a certified reverse mortgage professional with Reverse Mortgages SIDAC. Mike and Carol decided that they needed a one-level home to fit their changing health needs. They used the reverse mortgage to purchase their new home instead of using conventional financing. This has benefited them greatly. Barbara decided to do a reverse mortgage to pay off her conventional loan that she was making monthly payments on. She had funds left in the line of credit after paying that off. And a year or so later, when she fell and broke her shoulder, she was able to tap those lines of credit to pay for her home care. As she said, she would have been up the creek without a paddle without the reverse mortgage. If you'd like information on how to receive security, independence, dignity, and control in your retirement years, contact us. Hi, welcome to Savvy Senior Sources, where we guide your way through resources A to V, through the TV shows as well as our website and the Savvy Senior Sources Guide. You can find information on our website, savvyseniorsources.com, and the information is on the bottom of the screen. I'm Beth Paterson, your host, and I'd like to take a moment to say thank you to our sponsors, GWG Life and Reverse Mortgages SIDAC. I'd like to welcome back my guest co-host, Mary Rempfer, who is now with Liberty Oxygen and Medical Equipment.
Yes.
As a community liaison, right?
Yes, thank you for having me, Beth.
Sure, it's great to have you back.
Thank you.
And on today's show, we are talking about Medicare and Medicaid with our guest, Jeff Schmidt, who is with Schmidt and Anderson. And you're an elder law firm, and thanks for being here.
Well, thank you, Beth. It's a pleasure to be here.
Yeah, tell us a little bit about, and a tongue twister, Schmidt and Anderson. You had to throw Anderson in there to break up the S's, huh?
Yes, well, we're a law firm that practices elder law, which is a practice that's focused on estate planning, the traditional notion of wills and trusts, but the twist is that our services really provide an overall look at someone when they've got some sort of a medical problem, disability, chronic illness. There's a whole host of additional and unique issues that arise when someone has that sort of a medical problem, and we try to bring in all kinds of sources and look at all the different angles that someone would face under those circumstances.
And so that's a little bit about elder law, and elder law firms are different than estate planning firms, although you often do both?
Yes, we do general estate planning, but we understand and know how to implement and use government assistance programs, reverse mortgages, the different types of insurance that might be available, and bring that all together into a mix that would provide for people to be able to fund their care, their long-term care, and protect assets at the same time.
So Jeff, does an elder law attorney become kind of the point person for a client and family to help them plan successfully going forward?
We often become that point person because we are at the center of what's happening and can view the situation in a way that lets us have this wide-angled view of the situation. So, we may help refer to care agencies, or we might help refer to a geriatric care manager at the same time that we're referring to the reverse mortgage specialist or the person that's going to help with their financial planning. And we're also the people that would then help them access government assistance programs.
So,
Go ahead.
so it's a specialty, and all attorneys do not have that same view or practice.
The answer to your question is yes, but we have to be careful when we talk about a specialty and that term, because attorneys must be certified by a board in order to call themselves specialists. And there are real estate specialists and there are trial specialists who can become certified. The Minnesota bar has not generally, although the opportunity is there, chosen to become certified. So the focus of our practice is on elder law is the way that we would term it.
Okay,
And-
well, that's good to know and how to clarify.
And many of my colleagues would say the same thing, that their focus is on elder law, even though we
Okay.
don't call ourselves specialists.
Okay.
You know, there's so much confusion between Medicare and medical assistance and who pays for what and when does one kick in and the other one stops. Can you explain a little the difference between Medicare and medical assistance?
Absolutely.
And let's clarify, it's medical assistance in Minnesota, but Medicaid on a national basis, so.
It would be helpful if we changed the names to something a little more unique, but those are the names we're stuck with. Medicare is the government-sponsored health program or health insurance program that we can access when we retire or become disabled. It is linked directly to our Social Security and the Social Security benefits. It's health insurance. It pays for the doctor visits, it pays for the hospital. There's Part D to cover medications. The way I describe it more generally is to say it's the health insurance that will pay for the care to get you better. You get sick, you need a doctor, you need to be in the hospital, you need surgery. Medicare pays to get you better. That contrasts with medical assistance or Medicaid. Those are the same program. Minnesota just chose to call its Medicaid program medical assistance. That is a welfare type program where a person has to qualify financially and functionally before they can get benefits paid. But from that point forward, what medical assistance does is pay for health care just like an insurance program does. When someone's on medical assistance, however, the care that can be covered goes beyond getting you better, but also just taking care of you in a custodial fashion. So medical assistance will cover the nursing home, the assisted living, the memory care, the home care that you might get to just get you through the day and help you with activities of daily living.
And Medicare covers that, but if you have a crisis, if I'm understanding right, you have to be in the hospital before it will pay for some of the long-term care services. Clarify that for us, because I think
Sure.
that's confusing.
Medicare has as part of its benefit package the ability to pay for transitional care in a nursing facility where you've been in a hospital for at least 3 days. That means you really stayed over 3 nights, and you're released to that transitional care to get ongoing therapy to get you better.
Okay.
That's the key, is Medicare is saying, we'll pay for that because it's work to get you better. But we're limited to just 100 days of coverage, or that coverage will stop when there's a medical decision made that the therapy is not allowing you to get better or to maintain your current status. So if it isn't doing any good to continue the therapy, then you'll shift to a long-term care or a custodial status, and Medicare stops.
Okay. And how does Medicare pay for the nursing home cost? Expand on that a little bit more.
They provide direct payment to the nursing facility for those costs, and they will cover 100% of those costs for the first 20 days. From day 21 through day 100, there's a co-payment, and it's a varying amount that is adjusted each year. In general, when you buy Medicare, you will also buy a supplemental health insurance policy that will fill in the gaps that Medicare leaves. And those policies, at least the ones I see more often than not, will cover that copayment, so that when a patient views the situation, they see Medicare or their supplemental policy covering the full bill for that 100 days.
And how, Jeff, does a person know if they would qualify for medical assistance or Medicaid?
Well, Medicaid is based on 3 essential factors. One is you have to be a resident of the state where you're applying, you have to be categorically eligible, we would say, and you have to be financially eligible. A resident of the state is fairly simple. You're present in the state. We'll generally call you a resident. Categorically eligible means that you fit a category where you need the care. And it's blind, disabled, over 65. But you also have to show that medically you need the level of care that will be paid for. And there's a system that's in place to assess your needs and to determine that you'll fit that category. Financial eligibility is probably the more difficult one, and the one where we do most of our discussion and planning. For a person who is single, who's not married, available assets have to be reduced to $3,000 before you will qualify. Or to put it another way, if you have more than $3,000, you're not eligible.
Eligible, okay.
And that's neither good nor bad, it's just the fact that
But
you're not eligible yet.
a standard that you know if you should be pursuing Medicaid or medical assistance, and if your assets are over $3,000, quite a bit, you know right away that you wouldn't want to apply at this point.
That is true. That is true.
Okay.
It's a complicated set of rules that governs what assets would be considered available versus the assets that might be excluded or that have some impediments so that legally you can't get at them, and then they are unavailable for the time being. But in general, if we look at assets that you could potentially use to pay for your care, they'll be considered available.
Okay.
Checking, savings accounts, investments, retirement plans, cash value of life insurance, anything that you have that could possibly be made available is going to be considered available.
It sounds so confusing, and hence the need for an elder law attorney, correct? I mean, to navigate and figure the system out is doable, but it sounds like it could be very confusing, and a lot of variables could be missed when planning ahead for your care.
For medical assistance or Medicaid, there's often county workers that do applications. Talk about that and the role of the elder law attorney with the social workers of the county.
Medical assistance is a federal program at its core, where the federal government said to the states, we'll help pay for this medical care, but you have to take on the responsibility of administering the programs and paying what ends up being roughly half of the bills. In Minnesota, the choice was then made to delegate the administrative function to the counties. So individual counties have offices and hire financial workers who will process applications, monitor eligibility, look at verifications that you provide to them, and determine that you're eligible or you're not eligible or you continue to be eligible. In our firm, we offer services to take that application process from its beginning, even before we are eligible, all the way through to the end to be sure you've been approved, and beyond to ensure that you continue to stay eligible. And we offer that service because it's complicated enough that it really makes sense for people to have someone who's advocating for them at that level. And I'm very careful to say the people who work at the county do an excellent job, but they are overworked. They have too large a caseload, and they probably don't receive quite the training that they should have to understand all of the nuances of the program. And so our process is to go in and help them understand somewhat what their program is all about as well. But what that means is, without assistance on the application process, it's possible that mistakes will be made and that you may not be eligible when you really should be.
So,
How
that's
frustrating
what-
would that be? you
Yeah,
know?
no kidding.
So it would be nice to have an elder law attorney to refer to and help guide you through that process. You know, Jeff, one of the things I wanted to circle back with you is that you had mentioned when someone's in the hospital that they have to have 3 days, being admitted into the hospital for 3 days to qualify for a transitional care unit, for Medicare to cover that after discharge. You hear a lot these days about being admitted to the hospital, or you're on an observation bed at the hospital. What is that all about, and what do seniors need to know about that?
What seniors and anyone, I guess, who's on Medicare need to know is to be very careful to ask if they're being admitted to the hospital or that they're simply under observation status, and to know that difference. The most important thing to do is ask. Being admitted to the hospital is as it sounds. You're admitted, you become a patient with all of the requirements that are there for that. If you are in the hospital under observation status, they have not admitted you, even though it will look and feel the same. The consequence is, if you're not admitted to the hospital, you can't count the days you're there as the 3 or more days that would then qualify you for payment of the transitional care after you leave the hospital. And what we find are patients who are having perhaps a fall or stroke-like symptoms, and they go to the hospital. They keep them there under observation status. They're then moved into a facility to get ongoing care or therapy, but there's no coverage at that nursing facility. And there isn't a good way to know whether you're being observed or you've been admitted unless you ask. There are regulations that have just gone in place that should require hospitals to make you aware early on in your stay that you're under observation status rather than being admitted, and giving you an opportunity to then appeal that and actually advocate for yourself to say, no, I should be admitted in order to access all the services.
Boy, I can see somebody who doesn't know, and then they're ready for discharge, and they find out that it's all under observation and they weren't admitted. Are they responsible to pay for their hospital stay then? Or does Medicare still cover that?
Medicare covers the observation status. It's not that you end up paying that hospital bill on your own.
Okay.
But as you're released from the hospital, if your choice is to then go on to a nursing home or a transitional care facility, you will pay for that care on your own.
Okay.
Wow. So it's real important to know and ask the question, am I on observation status or am I considered admitted for the coverage? And you need to be your own advocate.
You need to be your own advocate for that particular fact, but I also am stressing with all of my clients and anybody I work with that you have to be an advocate for all and any kind of health care that you're receiving.
Yeah.
That's
Ask
a great point.
lots of questions. Don't assume that the medical people know everything, because they're busy and they have lots of patients and they have all kinds of other complications going on. They appreciate it when you take the time to actually look out for yourself.
Yeah. So, or at least have a family member
Yes.
looking out. Now that's Medicare, not Medicaid or medical assistance,
Correct.
right? So just trying to help clarify, because it can be so confusing.
I know.
Anything else we need to know about Medicare?
I don't think there's a lot more to discuss. There could be a series of shows that you do for someone, not me, to come in and explain how to choose the best Medicare
Yeah,
plans
that would be a
for
different
someone, but generally once you've chosen and you're on, it's honestly quite good coverage.
Okay, good. So going back to the Medicaid or medical assistance in Minnesota, we kind of talked about some of the eligibility for that of the spend down. But we've heard about people giving away assets in order to qualify. Expand on that a little bit.
When medical assistance assesses your eligibility, it's based on financial need. If prior to applying you've given away assets, you've made gifts to family members, let's say, the program needs a way to recognize the fact that you had those funds and chose to give them away rather than to use them to pay for your care. And since medical assistance is funded by all of us as taxpayers, there needs to be some recognition of that. And the way they have done that under the rules is to say, when you apply for assistance, you will first have to report any gifts or transfers that you've made within the 60 months or the 5 years prior to that application. If you report a gift or a transfer, the rules will then assess a penalty. It's not that this is illegal. It's not that you're not allowed to make gifts. It's a simple recognition that you had the money and gave it away. And so what they'll do is look at the value of all that you gave away within that look-back period, we call it, divide that total value of the gifts by the average monthly cost for nursing home care. And the answer to that division problem is a number of months when the medical assistance program is not allowed to help pay for any of your long-term care services. It's extremely difficult to manage or work through that sort of a penalty because it only begins. The months of ineligibility only start when you apply for assistance and prove you're eligible.
Okay.
Which means the penalty begins when you can show that you need the care and you're out of money. And then for the following number of months, which can be an unlimited amount, you're not eligible to get any help to pay for the care just when you need it the most.
Yeah. I had a reverse mortgage client. We did the reverse mortgage, and because the reverse mortgage is not considered income, you can do both. You can have the reverse mortgage and still receive medical assistance. However, there's some little nuances in there that need to be paid attention to, that if you pull out more money than what you need in the month that you receive it, then it's in your checking account, and then it could be considered an asset and impact your qualifying. I had a borrower that we did the reverse mortgage for, and they were applying for medical assistance at the same time to cover her home care. And they had taken some money out from the reverse mortgage to pay for the next month's care. But then evidently when they did the application for the medical assistance, the mother had given the daughter some money in the previous 5 years. So what they did was the money from the reverse mortgage, they paid back into the reverse mortgage, and then so that she would still be able to qualify. So there are some different options of trying to do that, right? I mean, this was an example with a reverse mortgage, but if you don't have a reverse mortgage, the family can pay it back.
If we need to undo that period of ineligibility, it's a simple matter of giving the assets back. Once we've applied for medical assistance, the rule says we have to give back all the assets. And if we give all the assets back, of course, now we may have raised the level of the assets above whatever the qualification limit is. So you still may not be eligible, but at least you aren't working with this penalty when they will just absolutely not help you. And what we do with our clients is view that opportunity to make gifts as something that is possible and certainly doable with a reverse mortgage or creative uses of an annuity, or perhaps we just have enough time that we believe we can make it through that 5-year look back without needing medical assistance. But in every case, we're extremely, extremely careful about knowing how much we're giving and when we're giving it and who will have it and will we be able to give it back, and what if our worst case scenario comes into play, how can we manage to be sure that the person who is the focus of this will always get the care they need.
Okay, we have 1 minute left, and I want to touch on making sure a spouse has enough to live on if one of them needs the long-term care, and literally a minute. So let's keep it short answer if we can.
That'll be a challenge. When it's a married couple, medical assistance measures the total value of their assets. That total is divided by 2, and the community spouse, the one who's healthy, is allowed to keep the lesser of half of the available assets, or an annually adjusted maximum figure that right now is just under $120,000. So a community spouse would keep the house that she's living in, that's excluded, 1 car, household and personal things, and up to about $120,000.
Okay, that's a quick, short answer. And reach out for more information or clarifying that. Thank you, Jeff, for being here. Again, Jeff Schmidt with Schmidt, and Anderson Law Firm. And again, thank you to Mary Rempfer with Liberty Oxygen and Medical Equipment. Thanks for being here again.
Thanks for having me.
And don't forget to visit our website, SavvySeniorSources.com. And a special thank you to our sponsors, GWG Life and Reverse Mortgages SIDAC. Thanks for joining us today.
What is the secondary market for life insurance? The secondary market for life insurance is an emerging financial market that provides individuals options with their policies. These options allow policyholders to benefit from the value of their life insurance. Policies are sometimes a financial burden, especially for seniors, as premiums often increase over time. The secondary market offers financial alternatives that can help policyholders benefit from their life insurance now.
Hi, I'm Beth Paterson, a certified reverse mortgage professional with Reverse Mortgages SIDAC. Bob's wife passed away, meaning his Social Security income was cut in half. His financial advisor suggested he look into a reverse mortgage. With the reverse mortgage, he was able to take a dream vacation with his nephew, and oh, the stories that they can share. After Bob passed away, his niece shared the difference that it made to the whole family. Dorothy did the reverse mortgage in order to protect her other retirement funds. With her line of credit, she was able to travel, buy a new car, and do home repairs. Years later, she's still benefiting from the reverse mortgage line of credit and not having to rely on her children. For more information on how you too can have security, independence, dignity, and control, contact us.